Hello, all of you bold, beautiful, brilliant, and highly evolved souls. I'm Davina, and today I'm going to talk about self-assessment. And it's really important, or at least I think it is, to have a non-judgmental self-assessment. And this can be so very, very difficult. I know for myself, whenever I have a feeling, there's usually shame attached to it, fear attached to it. Um, Pretty much anything that's going on with me, there's usually some sort of, yeah, shame or judgment there, or yeah, fear coming along with it. And so it's very difficult to just sit back and sort of objectively look at, like, how am I doing right now? And especially when we're dysregulated, it's even harder to actually figure out how I'm doing and what to do to sort of maybe lessen um, the suffering or the pain or how to get ourselves a little bit, just even a smidge back on, a little bit more balanced or regulated. So I'm just going to go over 5 points here, and probably nothing that you haven't already done, but yeah, it's just kind of on my mind today. So number one is, just how grounded am I? So notice, am I feeling the full weight of my body? And can I feel my feet? If I'm sitting, do I notice, like, my legs really, on the chair, heavy on the chair? Um, or do I feel like a little bit light, a little bit like kind of floaty, floaty kind of sensation, like I'm not quite all the way in my body? And I guess for all of these tips, it's kind of good to have a kind of a baseline. So if you kind of remember what you feel like when you are regulated, then you can kind of more easily tell when you're dysregulated, when you're in a flashback. So first one is, just how grounded am I? And yeah, am I regulated, or am I really, like, and you can use a scale too if that helps you. If you think of, like, okay, really grounded is like a 10, you know, really, really ungrounded is a 0. So where would I fall in that right now? And just, again, not a performance thing, but just as a self-assessment, so you can understand where you're at. Number two is, how's my breath? And yeah, it can be difficult to, again, figure out, like, where that, how to really assess. You can notice, like, how full your breath is. Is it full? Is it shallow? Is it quick? Is it slow? Um, and often, like, if you go into the kind of hyper arousal state, your breath might be, faster or more shallow. If you're in the hypo arousal, it might be really, like, almost hardly there. I mean, that's what I notice when I'm in that kind of state. And then, of course, in that hopefully balanced area, you have a full, long, easy breath. You can also ask yourself, is it easy to breathe, or does my chest feel kind of like tight or constricted in any way? And again, just try to notice it, and not trying to change or fix anything, just noticing how the breath is in the moment. Number three is noticing the body. Is there any tension in my body right now? And then just kind of do a quick kind of body scan. And if there is tension, where is that tension? Or if there's any sort of other sensation going on, maybe there's a little bit of pain, or a little bit of discomfort somewhere you notice. And when you're in a flashback, it can be very interesting to notice these little sensations. They can just arise and just pass away. It can be really, I think that I'm beginning to think that all body sensations are actually part of a flashback. Like, I'll suddenly, like, notice something in my ear, or like I was going for a walk and suddenly, like, soles of my feet felt a little bit like sore. And I sat down for a minute and I was feeling like heavy. And I'm like, what is this? And I realized I was comparing myself to everybody and I was feeling a bit low. And I sat down and oh, I'm feeling inadequate. I'm feeling like a loser. And I cried and cried. And then it kind of lifted. And suddenly, the feeling, my feet felt normal again. And so these sensations are, if you notice something in your body, it's likely that you're in a flashback and that sensation is tied to whatever your emotion you're feeling. So just become, curious about what's going on. It can be very, very scary in a flashback to be suddenly like, I don't know, noticing something else in your body and going, oh, now what's wrong? And it can be really panicky, so just try to like, okay, I'm noticing this sensation in my body. And it's, like we don't have to try not to go into that drasticizing, catastrophizing, and just noticing with compassion and curiosity what's going on. Again, very difficult to do, but number 4, what's going on in my mind? What's happening there? What are the quality of my thoughts? And what is the content of what I'm thinking? So you might even want to just write down, because sometimes it's hard to like really realize what I'm actually thinking about, or talk it out loud. I do that a lot, talking out loud and noticing, oh, this is what I'm thinking about. And it helps me figure out, what's really going on underneath that is usually some sort of emotional pain or feeling. Sometimes I'm just like in a grumble, and sometimes that's anger, sometimes that's grief, sometimes that's fear or hopelessness, sometimes that's shame, or, so it can be, a lot of things. Your thoughts can give you a clue as to how you're feeling and what's going on for you. Again, likely if your thoughts are, really kind of negative, or your thoughts are obsessive, or your thoughts are racing, it's a very good sign that you are in a flashback. And if you can easily, get into a calm headspace, you're probably quite regulated. So and the last one is, how am I feeling? Which is what we kind of want to get to. And it can be difficult to distinguish feelings, especially in the beginning. And probably as a highly sensitive person, you'll develop, if you haven't already, really good skills at figuring out what emotion is going on. And I've got a feelings wheel. I've probably shown it a couple of times, but here we go. Feelings wheel can be really helpful to keep around. It just, you can start developing, more words, like, and get more specific about your words, like not just sad, but maybe I'm feeling disappointed, I'm feeling heartbroken, I'm grieving, I'm feeling depressed, or whatever. You can start discouraged, like there's so many words to better define, exactly what you're feeling. So I hope that yeah, that's a little helpful for you. Again, like trying to turn that from a shaming, fear-mongering voice that we heard from our parents, to a more compassionate and curious, kind of like just as you would a child. If you're caring for a child, you're just like, oh, how are they doing right now and what do they need? And kind of developing that kind of what do you call it? Anyway, developing that sense of, yeah, just treating yourself like a child and just figuring out what exactly is going on with you moment to moment. And with C-PTSD, it's definitely moment to moment, like I'm having one kind of flashback in the morning, another one in the afternoon, something else happened in it later in the afternoon. It's just like, and of course you probably know this, is just like constantly like different things coming up. And yeah, so it's certainly a roller coaster. And yeah, it's riding these waves. So yes, I hope that you're doing well, and I'm wishing you many, many blessings on your journey of healing and awakening. And I am Davina at Boldness Blooming.